So I look at treatment of allergies in 3 different ways. So number 1 is avoidance. So you want to find out what the patient is allergic to so you can tell them what to avoid. Number 2 are medications, and there's a lot of different medications we can try. And if number 1, avoidance, and number 2, medications aren't working, then there's number 3, allergy shots. And allergy shots are a long-term solution for a lot of patients. So it depends on what you're allergic to. With avoidance, you should usually remove pets from the home. If you can't remove pets from the home, you can keep them out of your bedroom or keep them out of the common areas that you spend most of your time with. With dust mite allergy, pillow covers and washing your sheets in hot water makes the most sense and is the best way to avoid these allergens. With pollens, staying inside during high pollen days, doing outdoor activities after it rains can be helpful. If you've been outside, you should come in, take a shower, wash your hair. Pollen really sticks to hair. You should change your clothes, remove the clothes that the pollen can be sticking to. Medications treat symptoms, so medications don't care what's causing the symptoms, they just treat the symptoms that you have from allergy. In general, a lot of patients can get good control with medications, whether it's an over-the-counter antihistamine or an over-the-counter nasal steroid spray. There are other options that are prescription for when those medications aren't working. So a patient can take an antihistamine, so when you have an allergic reaction happen in your body, histamine is one of the chemicals that is released, and antihistamines block that chemical from having problems. So most patients' symptoms can be controlled with avoidance and medications. Unfortunately, there are patients who their symptoms are not controlled with those measures. For those patients, I think allergy shots are a great option. Allergy shots over time desensitize the immune system, so patients are able to be around the things that they're allergic to and not experience the symptoms. Unfortunately, allergy shots do not work right away, and they do take a long time to work. You have to come in regularly for allergy shots. Most patients have to come in 1 to 2 times a week in the beginning, and after they do a build-up series, then they'll reach their maintenance dose of their allergy shots. Once they're at their maintenance dose, then they come every 2 to 4 weeks for their maintenance dose. Most patients have to be on allergy shots for about 3 to 5 years. Allergy shots are actually targeted at what you're allergic to. So if a patient's allergic to dust mites, they will receive allergy shots for dust mites. And we actually know the proteins that are identified that cause the allergens, and that the allergy shots contain these proteins. So over time, after receiving several doses of these, the patients will become desensitized and be able to tolerate these allergens. So I don't do allergy shots in kids under 5 because I want them to be able to tell me if they're having a reaction to the allergy shots. So they need to be able to explain what's going on if they're having a reaction. Allergy shots are indicated though for anyone who's 5 and older who have symptoms that aren't controlled with avoidance measures and medications. Allergy shots are a tiny little needle that goes in the back of the arm. They really don't hurt.